Hey guys, welcome to Southern California EMS Training Institute. My name's Tyler, and today we're going to be talking about medication administration, aspirin. Aspirin, you guys have probably seen this or maybe even taken this yourselves at home. But today in the EMS field, we're going to have a little bit of changes for you guys, and we're going to be talking about how to administer this medication. Now, first off, this medication is actually carried by the EMT on the ambulance or maybe in their med bag. This medication comes in 81 milligram tablets, but our dose is going to be 160 to 325. Essentially, we're going to give anywhere from 2 to 4 tablets by mouth. They're going to chew up this medication and they're going to take it orally. Now, the reason we take aspirin at home is pain, right? You're like, man, I got a headache or my knee hurts a little bit. I know, I'll take some aspirin. Right? That is why we take it at home, but that's not why we take it in the pre-hospital care setting. Right? Our indication for this medication is chest pain of suspected cardiac origin or acute coronary syndrome. Again, maybe this patient's having some angina or maybe a myocardial infarction, a heart attack. Right? They're having that heavy, dull pressure chest pain that's radiating up to their neck, jaw, or left arm. Those patients might be wanting to receive aspirin. So that's going to be our goal for these patients. Now, what it actually does on the body is it's what we call a platelet aggregate inhibitor. So it keeps all the platelets from sticking together or clumping together. Or what we'd say, it stops any aggregation, right, the sticking together of platelets, especially inside those injured or damaged coronary arteries. That's why we're going to give this medication here. There's not really any contraindications for this medication other than allergy to aspirin. You should be aware if the patient's been throwing up any blood or having any bloody bowel movements, maybe don't give them this medication as well. Some things to be considering when we're dealing with aspirin. Now, as far as aspirin goes, you guys, before we administer, hopefully we have assessed our patient, again, contacted medical direction, and done our 6 rights and D-dice before administering this medication. What we're going to do, like I said, is we're going to pop off the top, pull out either 2 to 4 of these tablets, and have the patient chew them up by mouth and swallow them. Now, if this patient's taken aspirin prior to arrival, we shouldn't be re-administering it. If they maybe dispatch before you arrive, told them to take 4 baby aspirin, right, we don't need to give any more. However, right, if the patient's not sure or a patient didn't take any aspirin or last time they took aspirin was this morning, they took their normal dose of just 81 milligrams every single day, right, then we can re-administer the full 324 or 325. That's more than acceptable. But for most cases, if they've just taken this prior to our arrival, we don't need to give them more aspirin because that's not going to do them any benefit. So we can always ask our patients, right, hey, have you taken any aspirin yet today, earlier, maybe when this chest pain started to come on? Sometimes these patients know that not only are they supposed to take their aspirin when they're feeling chest pain, but maybe they're also supposed to be taking their nitroglycerin. So always ask if they've done anything to help alleviate those pain symptoms so far. So, again, this is Aspirin with Southern California EMS Training Institute. Hope you guys learned a little something, and we'll see you guys later.